Good evening, this is Abhijit Nandi Majumdar once again on ANM News, and we are on a very crucial turf in the fight against coronavirus. Grim situation, very negative feedback coming from all over. The number of new cases are ever increasing, death rate is increasing, and you look around and you find not a ray of hope. But is the situation so bad? Are we need to be real worried? Do we need to be panic stricken? We're all going to find out today. We have with us a very senior doctor, Dr. Anjan Soitiya, a very senior doctor here. Of course, he's a cardiologist and he has been dealing with patients for a very long time. Welcome to our show, Dr. Soitiya.
Hi, good afternoon.
Dr. Sir, the first question that comes to our mind, the first thing that's ever evolving, of course, I hope you're all safe, your family is safe, and you're all safe and sound. That's the primary concern.
I hope the same is the case with you and your team members and your family.
Yes, we are doing our bit, but of course we are taking all precautions to ensure that we all stay alive as long as we can. So, Dr. Saab, now the first thing is that, what is the current status of the situation? Because COVID-19, there are no vaccines. We were in that press conference by the WHO Director General yesterday where he said it's a long battle ahead. There are no vaccines as such. There are a lot of researches going on. One medicine coming up here, another medicine coming up there. All bits and bits of information coming in from several places, and it's a permutation and a combination of several medicines and factors and plasma therapies and all. So what is the situation at the moment as far as COVID-19 is concerned? Are we really need to be worried?
See, I think it's all very confusing for all of us. Okay, this is an unprecedented situation. It's a new virus. This kind of pandemic has not happened ever in our living memory. We are all unprepared to deal with it. We don't know what the treatment is. There is no treatment actually as of now. There are no proven medicines. Vaccine, if at all it is available, is months, years away.
Dr. Sir, we just because last few lines we cannot waved off. Can you just repeat what you said just before, because you are a little less audible? If you can just increase the volume of your microphone, or maybe come a little closer so that I can hear you a little clearly. Can you hear me? Dr. Saab, we lost audio contact with Dr. Soitiya, but he is a very important member of the doctor fraternity who is fighting the COVID war, and he's a very important doctor. We'll just once again try and establish connection with him. Dr. Saab, can you hear me? We are not being able to re-establish contact on the audio, but what we as the entire country and the entire world tries to grip with the COVID-19 here. We are trying our best to ensure that doctors and health workers are all taken care of, and government is rolled out a strategy to ensure that the doctors and the health workers are all well protected. And what exactly is the scenario here? We're getting to hear from various quarters. We are getting to hear it from the political leadership, from the government. We have been given several advisories, but there are several questions which usually crop up in the minds of people as to what exactly the scenario is, what exactly where are we standing at the moment in the war against COVID-19, and is it what is our whether we can be able to take care of ourselves, and whether in such a situation, how do we remain healthy, how do we remain fit? These are very pertinent, very important questions that are cropping up in people's mind as we as we talk, yesterday the World Health Organization Director General mentioned that he emphasized on the fact that a very early warning was, the countries were warned long before in end January, in the first week of February, about the fact that COVID-19 is a very major epidemic which later turned out into a pandemic. So countries were warned to take action. But then again, he mentioned that he didn't name any country, but he mentioned that many countries did not take those precautions. Now, the fact remains that if you do not take precautions, then you will be you will be exposed to COVID-19. Now, we are getting reports from various quarters that this is getting spread around the place. We have been able to re-establish connection with Dr. Soitiya. Can you hear me, Dr. Sir?
I can. Can you hear me?
Yeah. No, I can hear you. I can hear you back. As we are discussing, Dr. Soitiya, the World Health Organization DG yesterday mentioned that it's a long road ahead, and in COVID-19 cases, we are at this moment at a crossroad. And trust me, we are getting a lot of feedback from various places, and people are very confused. So if you can just guide us through as to a person who is not suffering from COVID-19 now, what should we do to stay fit and healthy?
Right. So yes, very, very important question, but unfortunately a very, very difficult question to answer, because I don't think anybody on the planet has an idea about how to deal with the problem. This is, as you know, a very unprecedented situation, new virus. There is no established treatment of this condition. The world has not seen a pandemic like this in our living memory, especially with such an interconnected world where people are traveling all the time, and it has spread all over the world. And in the absence of any definitive treatment, we know that the best way to deal with this pandemic is to prevent or reduce the spread of this disease, and that one can do by taking the precautions that everybody is talking about: staying at home, social distancing, not coming into contact with anybody, or maintaining social distance, covering your mask all the time, washing your hands every time you come in contact with something, and that can help to some extent. But as far as the definitive treatment is concerned, I think a lot of research is going on. As of now, none of the medications that we have so far have been found to be useful against this virus. Vaccine is months, maybe years away, so we can't depend upon that for the time being. So at the time, it's all very, very grim. Fortunately, this virus, compared to many other viruses of the same family that have come in the past, is not as lethal. So the mortality rate seems to be pretty low. I mean, it's still quite large as a whole if you look at the world, but it's according to published research, between 2 to 3% on an average. So the mortality rate is not very high. It tends to be affecting mainly the elderly people who are suffering from more serious form of disease, or people with other comorbidities like diabetes or heart illnesses. And young people and children are relatively protected from it, although they also die from this virus. And we have seen a lot of young patients and children dying from it. But by and large, it's a disease that affects more elderly population. And I don't have an easy answer of your question as to what should we do apart from what we are doing now, but more stringently probably, maintaining social distancing, not going out, and keeping ourselves safe. I think the most important thing is for everybody to cover their face all the time, put a mask on all the time as soon as you step out of the house.
Right, doctor. Now, one thing is that there are a lot of things flowing around social media, then passing around social media, stating that you eat these, you drink that to increase your internal immunity. Now, it's been said that if you have more immunity in your body, then you'll be able to fight the COVID-19, and they may not be able to. You won't be suffering from that disease. So of course this is a very vague. I mean, I'm a non-technical person, so this is which floating around in the social media. So is it true that if we can be a carrier of COVID-19, yet if we have a lot of immunity in our body, we may not be a sufferer? Then how do we increase the immunity of your body? If are the things that are floating around in social media true?
Yeah, so I'm floating around in social media. I try to keep away. You are right. There is no doubt that whether a person gets symptoms due to COVID or will die as a result of COVID depends a lot on the individual. So if somebody has a high immunity, then they are less likely to suffer from any significant disease as a result of this virus. In fact, it has been seen that almost 80% of patients do not develop any symptoms, are infected with the virus. So they may have the virus in their body, but they either do not have any symptoms or they have very mild symptoms because their own immunity is able to fight the virus. In a smaller portion of patients, maybe 10 to 20% patients, the virus can cause symptoms. It can overcome a patient's or an individual's immunity and then is able to cause symptoms, significant symptoms. And again, in a smaller proportion of these patients, overall maybe 2%, 3% patient, they may succumb to the virus because their immunity is very weak. So yes, immunity has a very important role to play. There is no doubt about that. But the question about how do we increase immunity? I mean, there are no easy answers to that. Good food, healthy diet is very important. Everybody knows that. But then I don't know if there is any specific food that increases immunity. If you read social media, I'm sure, I'm not, as I said, I'm not as active on social media, but there are lots of superfood, wonder food, do this and it will boost your immunity, do this, it will boost your immunity. I am not aware of that. Okay, there is no scientific rationale that I don't think anybody has tried, a clinical study or a scientific study where you drink haldi and doodh and, it compares people who are not drinking haldi and doodh to see that it is beneficial or not. But my advice to all your listeners, all your viewers is, if you think that eating a particular food or a vegetable or a fruit or anything, you think may be beneficial, try it. It's not going to do any harm, isn't it? But eat properly, eat healthily, exercise regularly. Exercising is very, very important. Okay, I know you can't get out of your house, but whatever little exercise you can do inside your house, it's very, very important. And last but not the least, stress. Being stressed will reduce your immunity. So don't take too much of stress. So simple things, healthy food, exercising, not taking too much of stress. So, meditation, yoga, all these things will boost your immunity. So I can't give you any definitive recommendations about what food to eat or not, but healthy food, exercise, meditation, yoga, de-stressing, all these things will help.
Doctor, as I speak to you, there are a lot of people who are sending us feedbacks, and one of those feedbacks mentioned that is taking iron tablets going to help in increasing immunity or going to help against the disease. So all this kind of
So I don't think anybody on the planet can answer that question. Coronavirus is a few old. Okay, so nobody has done a study of taking iron tablets in corona patient. People are doing studies, lots of studies are going on, research is going on, but they are trying to find drugs to treat corona. So maybe in years to come, we will find out if iron tablets will help or not. So I can't answer that question. But if your hemoglobin, and the purpose of iron is to make hemoglobin, which carries oxygen in the blood, sorry. So if you have adequate hemoglobin in your blood already, then I don't think iron will add much to your body or to your immunity. But if somebody is anemic, that means they have low hemoglobin in the body, then yes, taking iron tablet may boost their hemoglobin up, and it may improve their immunity as well. But you can't have a blanket statement that okay, the entire population of the country should start taking iron tablet and it will prevent corona. No, I wouldn't say that, and I don't think it's going to be true.
Very true, doctor. And in coming to this related context, now there is an advisory or some kind of a narration coming from different governments. I mean, the state government as well as the central government, that you take recourse to telemedicine and stay at home if you have got fever and low. I mean, if you are suffering from not any major diseases, then consult a doctor over phone. Get your medicines over phone. So, how much do you think this is effective?
Yeah, so I think there are two sides of this. Of course, when the corona crisis happened, all of us, as we were telling everybody, oh, stay at home, and that was the right thing to do. That still is the right thing to do but what we have seen in our practice and what has also been seen worldwide, even in the Western countries, is that the pendulum has maybe swung a bit too far. So yes, healthy people should stay at home, but what has happened is, because of the fear of corona, even people with serious illnesses, people with serious disease, serious symptoms are also not coming forward and seeking medical help. So for example, I am a cardiologist, and we have seen in our specialty that people with heart attacks, who have chest pain, they medical help, thinking that maybe it's just gas, we won't go, or they are scared to get an infection in the hospital, so they're not going to the hospital. Some people think, oh, it's a lockdown, we're not allowed outside, police will catch us, so they're not moving out. So for various reasons, people are not coming out of the house, going to the hospital to seek medical help, even if they have or they may have yes cardiac. So that, I think, is a big issue, and has been seen in the Western world, as I said earlier, and it has also been published in medical journals that in the cities where the death rate due to corona is quite high, it has been seen that sudden cardiac death at home has also gone up. So what they are implying is, a lot of people are dying at home due to heart attacks. And this probably is correct, because they say a lot of hospitals have seen a decline in the number of heart attack admissions. In fact, I worked in England for almost 14 years, and in the city where I worked in UK, in Sheffield, I was talking to some friends a couple of days back, and they were telling me that the same thing is happening in their city. And our hospital where I worked, in Sheffield Teaching Hospital, which is the kind of the tertiary center where all the heart attacks of the entire city and the nearby towns get referred to, they have seen a significant decline in their heart attack patients. So much so that my boss, my research supervisor, and who I trained under, had to go on the local TV channel and appeal to the people that, look, don't think that you are overburdening the NHS, the National Health Service, by coming to the hospital for cardiac problem. And don't think that you will get an infection while you are in the hospital. We will take adequate precautions. We are taking adequate precautions. So if you have a cardiac symptom, if you have a heart attack, don't hesitate, come to us. And if I would say that if you have a cardiac problem, do not stay at home. It can be very, very dangerous. We have seen patients coming to us very late after a heart attack. I have got 2 patients under me now who presented to us a few days after they had the cardiac event. So if patients present very late, then there is not much we can do to improve their heart function. If they present to us on time, we can do a lot of things to make them better. So my advice is, if you're in doubt, seek medical help. Don't stay at home.
So, Doctor, this time is very precious for a heart patient, and if somebody is suffering from a chest pain or something, they should not neglect it. They should immediately go to a hospital, consult a doctor.
Absolutely, no doubt about it. Yes.
And there is
any time corona, that's what I tell everybody. Any kind of cardiac pain, don't hesitate to at least go to an emergency, get an ECG done. Nobody is going to catch corona. I mean, for example, I work in BM Bedla, and our emergency department is fully equipped to deal with any kind of patient, any kind of cardiac emergencies, and the staff there they have been provided adequate PPEs and they take all the precautions. All the patients are screened at the hospital entrance, whether they have fever or not, whether they have a history of cough and all that. Then we take the patients in, patients are fully assessed. If we have any doubt that, they may have COVID, they are completely isolated from the beginning. The chances of cross-infection in any hospital that is taking it seriously, and I assume and I hope all the hospitals are, the chances of cross-infection is very, very low in a hospital if adequate precautions are taken.
So doctor, this is very, very reassuring because we tend to get a lot of feedback on this. People are not little panic stricken, especially people who are suffering from non-COVID-19 cases. Heart, chest pain, that there are also other ailments like kidney, colon. This is the change of season, so people are suffering from fever, and then which may not be connected to corona. So there is a sense of uncertainty, there is a sense of insecurity among a lot of those people, and it's very reassuring to know that you should not stay back and try and do this, especially if you are suffering from serious ailments, and you should always go to a hospital, and at hospital you do not have any chance of being affected by COVID-19. This is something very, very important that you assured, and it's very reassuring to know from you, Dr. Sir. So next, lastly, what we wanted to know, what is your advice to people, basically those who are on the brink, they may not be suffering from any chest pain or heart attack at the moment, but are a little scared and panicked and little stressed out. So what is your advice to them?
Yeah, see, I think it's normal human nature to be anxious, to be worried about what's happening. All of us are. Even as doctors, even we are worried about what's happening because we don't know how it will all end. I think that is what the problem is. Nobody seems to have an answer to this question: how will it all end? When will it all end? Okay, and what will be the impact on the world population as a whole, on economy, so many things. We all know that our livelihood, our lives, everything is affected by all this. So a little bit of anxiety is, it's accepted. Even doctors are anxious about getting infection. I as a doctor, I have to go to hospital every day. I have to treat patients. Am I not worried about my own health, the health of my family, my children, my parents, elderly parents? So I am also anxious that, I may go to hospital, I may catch the virus. I am not all that old, although not young anymore, but I may pass it on to my elderly parents. So I worry for them. I worry about my small children. I don't want to pass on the virus to my kids, but it's my job. I have to work. I can't say no to a patient who has a heart attack. I can't not treat that patient. But that does not mean I'm not worried, I'm not anxious. So yes, it will be normal for a patient, for a lay person, everybody to get anxious. But what I want everybody to is, if you take adequate precautions, if all the staff, like in our hospital at BM Bidla, all the staffs who are dealing with patients, they are wearing PPEs. They are completely covered head to toe. In fact, sometimes it's very funny. They all look like polar bears, or astronauts, and you can't recognize them at all. And it's funny, but we are glad that we are maintaining that level of hygiene, that level of supervision from seniors is there, that the right things are done. So the chances of infection is kept to a very, very, very low, as low as it is. I would not say it is zero, but it is very low with all the precautions we are taking. And if patients are proved to be corona negative, they have their tests done, swabs done, then they are moved to where all the negative patients are. So that way everybody is safe. When we do the procedures, again we wear masks, we wear visors, we are covered to toe with PPEs, and we wash our hands frequently, and sanitizing all the precautions we can. And I'm sure there is no reason why anybody should worry coming to a hospital if they have a serious heart problem. We can assure people properly, and the risk of getting an infection while in the hospital is much of somebody roaming around the streets or going for shopping and all that.
that's the major line, that roaming around in the streets, you can get an infection. There are chances of getting infection, but not in a hospital where all the precautions are taken. If you are suffering from some disease which requires you to go to the hospital, a person should not hesitate and should not be worried about anything else and should go to the hospital. Otherwise, that disease will aggravate and will reach a point of no return. Thank you very much, Doctor, for sharing all this information with us, and very, very reassuring information, which at least bolstered my confidence and which at least gave me a long ray of hope that if something unfortunate does not happen in and around us, if it happens, we have somewhere, some hospital to take care of us. Thanks a lot. Thank you very much, Doctor, for all your comments. Thanks for sharing time with us, spending some time with our viewers, with your thoughts, which were very, very pointed and very straight. Thanks a lot, Dr. Saab, and we'll keep coming to you later also when you need some more of these reassuring thoughts, or we get some more of information or as an update of the COVID-19 program. Thank you, Dr. Saab. Thank you very much.
Sure. Bye-bye.